Addiction treatment, I'm speaking now as a physician, is important because it helps save lives, number one, and more importantly, it improves the quality of life of each and every individual we attempt to treat and render treatment to. There are opioid dependent patients who can use a medication-free or substance abuse-free existence where they don't need medication and can rely on, for example, 12-step recovery in groups. Other people, depending on the recovery environment they go into, do better with agonist or partial agonist therapy, things like methadone and buprenorphine naloxone. And some people do better, they sort of want to have a belt and suspenders, and they ask to be treated with Vivitrol. Vivitrol is effective because it overcomes the issue of compliance. Someone comes to the doctor's office or their healthcare provider once a month, gets an injection, and they've got their medication for 30 days. And that medication, Vivitrol, again a long-acting injectable form of naltrexone, helps cut down on cravings for opioid-dependent people dependent on heroin and prescription opioid medications, and alcoholics who get the Vivitrol injection tend to drink less. And that's all evidence-based. I'd like to say that this is a very progressive move on their part, and progressive in the sense that it represents working with evidence-based medicine. If someone's been incarcerated and has had treatment for their substance use disorder, the best shot they're going to have is with the addition of medication-assisted treatment. In this case, we were talking about Vivitrol as giving the inmate a much better chance once he was released in terms of staying clean, sober, and ultimately avoiding future conflicts with the law and with society. If we don't treat these people while they're incarcerated, we're committing the error, and we're winding up with prisons and jails that are full of people who potentially will be reincarcerated, wind up in jail again, and really not ever be able to contribute to society. So imprisonment, incarceration is an opportunity for treatment, and special care needs to be taken when people are being released. If you have a friend, a relative, or a colleague, try to remove yourself from any personal feelings you may have about addiction or about mental health in general, because that stigma extends into mental health issues as well, whether it's schizophrenia, depression, or bipolar illness. Try to take yourself away and think about addiction as another physical illness. It's another chronic physical illness which is progressive. And if we don't help people early on in the course of treatment, in the course of the disease, it becomes more difficult to treat, and it often has a less favorable outcome. So I think we need to get less judgmental. We don't have to approve of the behaviors, but we want to look at an individual who potentially can have a life-saving, a life-altering moment.